Welcome to Self-Talk, where former foster youth like us share our real-life experiences with sex, health, and life.
Produced by the Reproductive Health Equity Project, these are conversations we wish we had earlier. Hi everyone, welcome to season 3, episode 2 of Self-Taught. We're foster youth talking about foster youth. My name is Emilio, and I'm your host for today. I'm joined by Elizabeth, Jessica, and Quinn to share some of their experience navigating stigma and bias, and to give us some really good advice on how to access the sexual reproductive health care that you need and that you so truly deserve. With that, let's jump right in. I wanted to start off by asking y'all, have you ever experienced bias or stigma when getting sexual reproductive health care, and how did you deal with that?
Ooh, stigma. I remember when I was like probably 17 years old, and I ended up having a doctor who talked about PrEP with me. And at the time, I was not sexually active and I was 17. So it was interesting how somebody was telling me about this so young. I didn't get in prescribed a prescription for PrEP when I until I want to say 20, like verge of turning 19 to 20 years old. But when I was 17 years old, I had a man end up coming and telling me that this is something you should be taking. It is very high statistics for homosexuals to have HIV or to catch syphilis or to catch STIs. And at the time, it felt kind of like if I was being pressured or someone was putting an agenda for me. And I did not think good thoughts at the time. It felt like if I was a number or a statistic rather than it didn't feel like they were trying to give me a resource. It felt like they were trying to push it on me.
Yeah. Yeah, it sounds like you were not just getting like the education, but you were getting like kind of someone else's opinion put on you, and that really sucks.
As an adult, I had another provider, completely different doctor from a different clinic, offer me this service when I was 19 to 20, and I had forgotten about it. But the way that they gave me this resource and they offered and recommended it was a lot more nicer and digestible for me. Like it didn't feel like you were pushing this on me. It was like, hey, this is here for you whenever you need it. I really recommend it. It saves a lot of lives rather than how it was for my first experience learning about this type of prescription. And it was definitely how the provider seemingly pushed it onto me that made me feel like, is this because I'm gay? Is it just because I'm gay and I'm going to get STI testing services at a young age that you're going to say, oh, you need this. This is mandatory or you will catch HIV.
It sounds like you definitely encountered stigma and definitely bias too. I wanted to see if anyone else wanted to chime in with their experience.
I would definitely like to add on. I grew up in the system from a very young age. And one thing that I heard a lot growing up is that a woman in foster care will end up pregnant,
Mm.
incarcerated, or homeless by the age of 21. So the homeless and incarcerated are for both genders, but specifically the pregnant one would stay in my mind because I wasn't sexually active. So I remember at the age of 16, I moved into a foster home where there was 5 other girls living there. And when I went to the doctors, it was just a regular checkup. If you know, you know, when you're in the system and you go to a new placement, you have to go get your physical. So we kind of get a physical more than once a year. But this physical was a little bit different because towards the end of the appointment, I had the provider come in and you know, the yellow card, the immunization card, you always know when you're up to your immunizations, especially when you're in the system, you're always up to your immunizations. So I was like, oh, what is that? Am I missing any shot? I thought like I got them. And then he was like, oh, this is birth control depot. And he he just explained that it was birth control, and then that's when my foster mom's daughter kind of got into it, and she was like, oh yeah, like I thought that birth control would be a good idea because you have a boyfriend and everyone, all the other 5 girls in the house are on birth control, so I thought it would be a good idea. That way you're not pregnant. And then she kind of made a little joke into her. She spoke Spanish, but she said, because if you have a kid, you can't be here with us. So
Wow.
it very much felt pressured into, and I was not sexually active at the time, but I don't feel like I was really educated about what is birth control, how does it work, how would it affect my body. I just felt like it was
Mhm.
very much peer pressured and put up onto me. And when you're younger in the system, you really respect people with titles. So I thought they knew what they were talking about. So I went ahead and I took it.
Yeah, it sounds like you had someone, you know, who we see as an authority figure a lot of the time. And I mean, a doctor, a lot of the time we think of them as like the end all be all of like, they know everything about health and they know my health, but it sounds like you experience bias with like getting someone who thinks they know better than what you do about yourself. And that's such an issue, and I've experienced that too when I was in care. It just um you know older folks thinking they know better about our bodies than we do, and that's such a problem. On the topic of how hard it is to speak up, have y'all like specifically felt like that anxiety to speak up, and how did you deal with it?
I think for personally me, having to write all of my questions out truly does help. I would go into an appointment that I didn't have any written questions out, and all the questions that I said I was gonna ask, that I knew what I was gonna ask going into, I just don't ask it. It like goes straight out of your mind once you're actually there, or they'll bring up something that completely takes your train of thought. And then when you're leaving the appointment, oh, I forgot to mention this and this and that. Oh, shoot. So going in with those questions written down, and then for the anxiety itself, it's kind of hard. You're meeting a stranger and you feel like you don't want to, for me, it was like you don't want to piss them off, or like you don't want to, like, oh, like you're wrong. Like that feeling doesn't feel good when you're that age. It's it's like when you're that age, you're trying not to like be disrespectful, but at the same time, if they
Trying to
say
get your
something
needs
that
met.
yeah, like you need your needs met. So like I don't say what I need to say, like I'm not gonna get what I want. I'm not gonna get what I need.
I just want to add to a lot of what Quinn said. I know in my own experience, there were several times where I would go to the doctor and I didn't feel like I had any power. The doctor would sit there and talk about my medical history and only address my foster parents at the time, who
Mm.
didn't know that information about me because I wasn't around in their house yet. But that doctor wouldn't address me. And I remember feeling like I had no power and feeling so frustrated. Like it was my appointment. This is the kind of care that I want. I need it. And it took me a while to get there, but I kind of realized like I'm going to make sure I am included in this. This is my appointment. And
Mm.
so for me, I took some strategies along the way. One of them was requesting to meet with the doctor alone. When it's just the two of us in that space, I also have authority in that room. And
That's
then
Mhm.
right.
and then similar to Quinn as well, like especially when I was nervous at the beginning, I would also bring in some notes, but then I could also reference it at any time just to make sure everything I want to get taken care of in this space, I have that opportunity and I have that space to ask my questions and get the care that I need.
Yeah, you're really showing them that you are the expert in your own health and your own body, and I think that's really good advice.
To be your own self advocate is the most important thing because, especially when you move around a lot, house to house, you kind of know your own health. Self advocacy is very, very important.
Yeah, definitely, I agree. I wanted to ask y'all on the topic of self-advocacy. have y'all ever had an experience or want to talk about how you handled, like, if a doctor wasn't respectful or wasn't you know, in a place to listen to you? Like, kind of what was the avenue that you took and how did you handle that?
As an extrovert myself, I am not scared to speak up. It wasn't more of that they didn't listen to me. There was a doctor that made me feel uncomfortable and tried to kick out the staff of my group home that like went with me. So like it was just going to be me and him in there for the checkup. And I spoke up for myself and I was like, oh, I would feel uncomfortable if I was alone in the room. I would like her to stay. So yes, I've actually have experienced a lot of health issues within the last few years. I get very dizzy, I get very disassociated. It's just a lot of different things that I know is not normal. You know how your body should feel. You know what's normal for you day to day. And I was going to this doctor and I would tell him every time, like, oh, I feel this and I feel that. And I would explain the different symptoms. And he would say, oh, it could be this or it could be that. But I didn't feel like I was ever tested for anything. So fast forward to now, it's about 2.5 years later. I am at a new doctor. I've been there for about a year, and I can tell the difference with patient care. She listens to my concerns, she listens to my symptoms. She doesn't jump to conclusions because she doesn't say, oh, it could be this, it could be that. She says, we can test for this, we can test for that. And from there, we will see. So I really appreciated that. So I think it's very important if you feel like you don't fit in with one doctor, if you don't fit in with one clinic and you feel like your needs are not being met, it's okay to go because you will feel the complete difference of care and your symptoms might still be there in the process of trying to figure out what exactly is wrong with your body, but you at least feel like you're getting somewhere in the sense that someone's listening to you. And I think that's really important.
Yeah,
Mm.
feeling heard and being taken seriously by your doctor is so important. So I think, like you're saying, changing your provider and knowing that you can do that and knowing that if it's right for you that you're going to do that is such a valuable insight.
I knew it was a problem at the other doctor that I was at because I would explain my symptoms and then he would say, oh, maybe it's your anxiety. Like, I don't think my anxiety is going to make me feel dizzy. And I've heard so many people have that same experience where they try to blame anxiety or, oh, maybe it's your like depression or like something out of the ordinary. So I don't know if you guys experienced that too, but that was a big thing. And I was like, okay, I definitely need to find someone new.
It's like they're saying
Yeah,
it's in your head.
Exactly.
in a way that in itself is stigma, you know what I mean? Like they're taking like your diagnosis and telling you like that's it. That's what you get to experience and not actually being committed to helping you. And that can be why it's so important to, have the right person talking to you and have the right person like advocating for you when you like need stuff, you know what I mean? Especially when it comes to sexual reproductive health.
You know, kind of interesting how we led up to this because I remember when I was with the providers, Borrego Health, I had first came to them when I was starting my facial feminization procedures and hormone therapy. And when I would go to them, there was a doctor who would see how I would have fluctuations with my gender expression. And at the time, because I was so young too, my gender identity was all over the place. And I would come in for a refill on my hormones and then a normal checkup for my wellness. And it would feel like walking on eggshells when it came to discussing, the real important things about me and my gender identity, the things that I was going through. It felt like if I said, oh, like there's times when it gets overwhelming and I feel like it's too much, or, sometimes my hormones fluctuate and I just don't know what I am. I couldn't, none of that could have came and been expressed because the fear of, oh, well, what if they say, oh, well, then you're not trans. I was young. I didn't know any better. I wasn't really educated. This was still like so all new to me. So it felt like if I expressed the wrong thing or if I said something wrong, they would take away the hormones or, well, then you're not trans if you still want to grow facial hair. And, these are things that like plague you and will stop you from gaining services. I didn't start facial feminization until I want to say I was 21 on the verge of 22. And I've known about it since 18 or before that. I knew it was there, but I was so scared to ask for it because there would be times where I would come in and they would see my facial hair or they would see me more mask presenting and they would mention it like, oh, well, are you sure you're trans? Or you that doesn't make sense. And they would comment on it. And that comment would be enough to just make me shut my mouth on certain things. I would go to this appointment knowing that I should be telling them very important information about how I'm really feeling or what's really going on. But I'm scared if I say that or if I admit that, then now I don't proceed with the services that I've been really wanting to, or they're going to snatch them away from me. And that relationship really wasn't a good one. And it wasn't until I switched providers and went to neighborhood healthcare, which has better options and providers who I can connect with more. That anxiety I felt when it was like hard for me to say what I really, really need or really want without feeling like it's going to go wrong. That feeling didn't come up as much really with my new providers. I've felt that I've connected with my providers, and building a connection with your provider allows that fear and anxiety to dim down enough to where you can communicate, you can talk and learn things that you didn't know about. Because when you have a connection with that provider, they do hear you, you do feel heard, and they do listen to you and go the extra step when it comes to getting you the services you need.
You're hitting the nail on the head when it comes to like you have the right to inclusive care. You should have inclusive care, and um, as we've said, I think we said earlier, like you know yourself best, so you need providers and people around you who listen to who you know you are. You know what I mean? Elizabeth, is there anything you want to add?
I think in terms of switching providers, in case anyone out there is a little confused about what that could look like or how to do that. Yeah, so Medi-Cal has a fee-for-service option and a managed plan option. With that first one, it's what most of us are familiar with as we're going through the system. You're able to switch providers at any time and see whoever you want. It's also your right to switch providers. So if you want to do it, just say so. Just switch to someone. As long as they take Medi-Cal, they will see you. The other option, that managed plan option, Medi-Cal automatically defaults you into this, and the county might select a plan for you, and then you have to see doctors that are within that plan. If that does happen, you can always call Medi-Cal and always call the county. Depending on the county that you're in, they might offer different plans. So then if you want to switch to another plan and try providers within that plan, or if you don't like any of that, switch to another plan, see as many providers as you want, right? The Department of Healthcare, like their website, has a whole bunch of information on this. But honestly, I would just encourage you to call Medi-Cal. Like, don't be afraid to just call them and ask these questions, ask them for information. You can
Bug their ear.
Exactly. You can always just start a phone call with them and say, hey, I'm looking to change providers. And go
Mhm.
from there.
And you have the right to do that many times.
Yeah. Yeah, and then for anyone watching and listening, we actually have in season 2, episode 1 of this podcast, we have a episode all about your rights to healthcare as a foster youth and how to access confidential sexual and reproductive health care, your rights to Medi-Cal, at what age things change, all that very useful info. I really appreciate you sharing that, Elizabeth. And if anyone's interested in, getting more of a deep dive into that, feel free to check out season 2, episode 1. With that, I think we have a lot of good info, but I wanted to ask y'all, is there any other quick tips about getting healthcare that, you think will be useful to anyone listening or watching?
If you're having trouble with getting a ride or transportation, there's also the Call the Cab services. It's an IE transportation team. You can call their number on the back of your medical card. They cover all kinds of different types of medical, behavioral health appointments. And it's case by case, varies for foster youth. But if you were to call the number and inquire about what Medi-Cal covers for you and your services for transportation, you can look up more information at iehp.org. They have a lot of tools to help you figure out everything you need when it comes to scheduling your own ride.
Oh, that's such a good resource. I've also heard that like Uber Health is a thing too, and they do like similar things. And I've also been told that they cover like anything that Medi-Cal will cover. So like therapy services, like you said, behavioral health, substance abuse, classes and stuff like that. So that's a really good resource. Thank you for sharing that.
Spread the word, spread the word.
Definitely.
I just want to add on to the transportation thing because that's a big issue for me. I wish I would have known that. Definitely going to take advantage of that. Thank you, Quinn. I know that here in LA County for the Metro, there's also something called the Life Program. And because you have Medi-Cal, that makes you automatically eligible and you could get 90 free days on the bus. And then every month there's a few, I forgot how many free rides they give you a month after the free initial 90 days, but I also wanted to put that out there because transportation is such a big problem and a lot of people do not seek the services they need either in a timely manner or at all because of transportation.
Yeah, it's true. I have had days where I'm like, I can't get there. So like I'm not getting there. And that shouldn't be a barrier to receiving healthcare and appropriate healthcare and good healthcare. Elizabeth, do you want to add anything?
Yeah, I think the only thing I want to add super quick onto this is especially with foster youth and like seeing a whole bunch of different providers, um, like Jessica mentioned earlier, as soon as you get a new placement, you go see someone else, right? Whatever that looks like. Um, I want to really say and highlight that you have the power. You can either request your own treatment and you can also refuse treatment. You can do both of those.
Mm. Mm.
And there are resources out there where you can go to like a community health center if you feel that that would give you better care. So there are other things out there that aren't your traditional like I don't know, your traditional doctor office, there's also like holistic methods of care if that's something, that you feel would be best for you. And so I just want to uplift that. Like think about yourself and like what type of care you feel you need and would make you feel the best.
Um, we've had a lot of great insights so far. And with that, I wanted to ask y'all, what advice would you, if any, give to your younger self, now that you have all the information that, you had and you bestowed upon us in this episode? What advice would you give?
I'd say ask a lot of questions. As we've been talking about, right? It's your health. You deserve to have a say in that care. Ask questions about side effects, base your decision around that. Ask for information. If you are aging out and are confused about the whole Medi-Cal switch, ask them for stuff. Ask them for information. Just always ask. Don't be afraid. Don't be afraid to do that.
Definitely. The squeaky wheel gets the oil is what I've heard.
That's
You
my
gotta
favorite saying.
Yeah, you got to advocate to make sure that you get what you need, because sometimes there should be other people advocating for you, but sometimes there's not. So you got to, take that extra step sometimes.
All I would like to say is what I would tell my little self. I've never thought about this question. Your timing is not everyone else's timing. So just because someone else says that you should do something like, for example, the birth control in that moment, or like, oh, I don't know, just timing, just what doesn't work, what works for one person doesn't work for the next is what I'm trying to
Absolutely.
Elizabeth said it perfectly. Ask those questions. Ask them all. Even if you think it's dumb, ask that dumb question. And what you don't know yet.
Yes, I
Be
truly
inquisitive.
do.
Be inquisitive.
And then one last question for y'all. If you want to share, what is something that you do to take care of you? So like any self-care, any coping skills or anything, but like what is something that you feel nurtures yourself?
go to nature. I'm a big nature person. I'm a tree
That's
hugger.
right.
I will
Yeah,
walk barefoot and ground myself. Be one with earth, you guys. The earth loves you.
I love that. Um, Something that grounds me or a technique that helps me is breathing, trying to regulate your nervous system, and then stretching, moving your body, getting extra energy and anxiety out of your bones, shaking it off as well. Also, grateful thing are like those grateful affirmations. I'm glad I woke up today. I'm glad I had enough water. I didn't get sunburned. Being grateful for every little thing you can be. Drinking tea. It works for me. I like tea.
I love a good beverage. Tea's a good one, but I'm a beverage girly. What about you, Elizabeth?
Yeah, one piece of advice I was given that I try and live by every day is to make sure you're doing 3 things every day. The first one's for your body,
Ooh.
so exercise, moving around, whatever that looks like. One thing for your mind, like reading a book, learning something new, and one thing for your heart, which is like doing an art project or, spending time with people you care about. So as long as you're doing those 3 things every day, having a pretty good day.
That's
Mm.
cool. Yeah, I love that. Thank you all.
Thanks for listening. To hear more and support our cause, like this video and subscribe to our channel.
And check out fosterreprohealth.org for more resources.